let's talk a little bit about the HIPP paperwork. So, raising neurodivergent kids is messy, beautiful, and a lot. I'm Mary Ellen Yates, and this is Growing Together, Neurodiversity at Home. Let's figure it out together. So, if you qualify for Katie Beckett, then you also have the chance to apply to HIPP, which is a program that provides refunds for the health insurance premium that you're paying for your other insurance. And they do an analysis to decide whether it's cost effective to pay back that reimbursement so that you're able to afford to keep your medical insurance. So they have the instructions for that form, and then here's the application. In the past, it has just been part of the Katie Beckett packet, and they still include it in the packet, but they used to have you just fill out the form and send it with the packet, and then Katie Beckett would forward it on. But I guess things have changed for whatever reason, and in the packet, it gave instructions to not send it with the Katie Beckett packet, but to send it to HIPP directly. So I did that, and for one, the address in the Katie packet was incorrect. I had the extra cost of doing priority mail twice. So then I looked up HIPP, and it had the new address, and it even said we have moved recently, this is our current address. And so I resent the form. Other thing with this application. So after I was approved for Katie Beckett, I immediately checked in with HIPP, seeing what was going on with the application, because I never heard back from them. They were very quick to respond, and they sent me a denial letter and a new application packet. And then one of the employees called me. She was very nice and helpful. She called me to explain why she had just sent me all these emails, and she said that when they get the application, they check for an active Medicaid number for 30 days. And then after that time, they decline the application, saying that you don't qualify because you don't have an active Medicaid number. Well, the Katie Beckett Medicaid process, they tell you it usually takes about 90 days. And our process took even longer. But anyway, so I asked the employee, so since it usually takes Katie Beckett 90 days and you usually deny these within 30 days, should we just wait until we hear back from Katie Beckett before we send the application? And she said that she couldn't say that because part of applying for Katie Beckett, you're supposed to also apply for HIPP. So she couldn't instruct us to do it in that way. I just want you to be aware of the process, and so you might want to make a decision on how you do that. If you delay sending that HIPP more into that time frame of when you're hopefully going to hear from Katie Beckett or what, but just to be aware that that's their process, and you're likely going to just get a termination letter and have to redo the whole process. And with this application that you fill out, this is just one application to get the ball rolling. To apply for HIPP, you'll need explanation of benefits, medical, and pharmacy from your insurer. Download them in the portal or call. The HIPP office will tell you the exact date range. Ours was all of 2024. The policyholder also has forms. My husband's HR completed their section and sent the employee rate sheets used to choose a plan. It's smaller than the Katie Beckett packet, but coordinating with insurance and HR actually took longer. We submitted electronically and got confirmation. Now we're waiting on the decision. Okay, let's walk through the initial application included in the Katie Beckett packet. The head of households is the person that is insured. So I put my husband's name. Referral source is the person filling out the application. So I put my name. Our addresses are the same. Telephone number, I put my husband's telephone number. For a telephone number, I put my telephone number. And then you're putting your insurance information here. And then it's asking if the policy number referenced in number 1 is the primary policy. Yes. Is there a second policy with another employer? No. We have no other employers. My husband is the only one with insurance. And then you have to fill out employer information that you're receiving your insurance from. And then you're listing all the Medicaid eligible persons covered under this policy. So I put my 2 sons' names because they have the Katie Beckett Medicaid and their information and the relationship and all that. And then, are any of these persons pregnant? No, my sons are not pregnant. But if one of them was, you would be putting that information here. I just put no. And then number 7 asks if the people in number 5 have been diagnosed with a medical condition And if yes, list your medical conditions. So I put my kids' names, and then I said see attached because there's not enough room. And then I just used that same medical diagnosis form that I used for the Katie Beckett stuff. And then you're putting how much the premiums are for the policy, how often the premiums are paid. So my husband gets paid biweekly, so we put that. And then this is if you have COBRA. COBRA is when you still pay for the health insurance that you have even though you've changed jobs. This does not apply to us. It asks if they can contact your provider and insurance carrier to verify this information. We picked yes because we figured if you put no, they're probably just going to deny your application. And then this is asking about workman's comp. If anyone's been injured, this is not something that applied to us, so we put no. And then this needs to be signed and dated by the policy holder only. So that's the person that's listed as the head of household. So that my husband signed and dated this form.